Welcome to our podcast for January. I have a very special guest that I am excited to have. It may be somebody that you've heard in the media several times. She has brought information to all of us with respect to COVID-19 and helped answer a lot of questions, and I think settle a lot of fears with COVID-19, and of course calm the nerves after you hear rumors and such. So we have Cynthia Carr from EPI Research Incorporated. Thank you so much for spending some time with me today.
My pleasure. Thank you for inviting me.
Well, I have thought about this for quite some time, and I thought I would save it until the new year because we heard about the vaccine coming, and we know that that's there's some speed bumps with the vaccine, and we're run into some problems. But this is all new, and I think people have to understand that the last time something of this magnitude happened was 1918 that I could think of in my history lessons. But there's still a lot of fear out there. There's still a lot of unknown. And I talk to an awful lot of residents that are concerned about it, that don't understand it, that they see numbers of 100 or maybe a little bit higher, and then they don't know why we have to be restricted to homes or restricted to numbers. And I'm hoping that you can help shed some light on that, Cynthia.
Absolutely. And, it makes sense that people are fearful. This is a whole new territory for everyone. Even, I've been working as an epidemiologist for over 25 years now. And, this is the first time I've seen something of this scope. SARS and H1N1, as challenging as they were to the healthcare system and to community, and there were associated impacts on economic and social well-being for sure, we're really nothing compared to what we have experienced and I would say endured in the last 12 months. So it's okay to feel anxious and fearful. I think that's normal. The challenge too is that thinking from my psychological background, my psychology degree, is we know that the longer that anxiety we know that the longer that uncertainty continues, even if it doesn't really change that much, it's just kind of uncertain from the beginning of like, what is this virus? What does it mean? What's going to happen? Sort of that continued uncertainty. With that comes kind of an escalation and disproportionately in anxiety. So the longer uncertainty continues, the more our coping skills start to kind of falter, and the more we become kind of more anxious and stressed. And of course, with that is not just the duration, the length of uncertainty, but the kind of loss of many things that help us cope. So for people who love to go to the gym, like my father, who's retired, that was his outing every day for his social well-being and his physical well-being. He looked forward to that every day. That's gone. Those of us that go to church, those of us that like to go to hockey games, those of us that, get together with our families and friends, all of those social connectedness aspects in our life are really changed and different now. And so it's much more difficult to think of how do I deal with my stress and my anxiety, because all of these things that I would normally do are gone, and I don't know when they're coming back, and I don't really have any control of that.
That's very true, because that's kind of what I feel as well, because I'm used to being very active in the winter. I'm involved in minor hockey, a referee in chief, working with young people. And as much as I thought I wouldn't miss that, I do miss that. I thought, oh, this will be a nice break. But for the first couple of weeks, maybe even 3, 4, it was a nice break. But now it's something that I'm struggling without. I miss. So using your psychological background, or your psychology background, my apologies, will there be different phases that we go through? Because I hear from other people too, and friends that I'll have conversations with on Zoom or telephone call, that it seems like tensions are getting very high. And here in this office, it's really interesting. The number of complaints, you can always tell when tensions are getting high, seem to rise exponentially. And then they'll calm down a little bit, and then they'll rise again. Is that normal?
That's right. So the number of complaints rely to what our perception is of what's going on. So something that might have been a minor annoyance or might not even have been noticed prior suddenly becomes a big deal, worthy of literally an email, a text, or a phone call. So it certainly reflects what our state is, what our coping strategy is. The last straw kind of situation might be that the meter reader stepped on our plant or something, and I'm going to phone and make a complaint. So again, when you think about and reflect back exactly to your experience, when this started, there was that uncertainty, but there was also a little bit of I don't want to use the word excitement, but novelty, something new, and an opportunity for kind of a break. Everybody talked about, I wasn't one of them because it's not my area, baking and cooking for each other and those kinds of things, but they get old fast. And I can tell you that there was 2 examples in my own family in March when everything shut down. One was my daughter, who was in grade 12, and the other is my son, who was in his second year university and playing junior A hockey. Immediately when things shut down in March, my daughter her perspective immediately was, yay, March break starts early. How exciting. We get another week off and then we're going to Mexico, right? My son had so she's way down on the scale of anxiety. Even though uncertainty right away is high, what's going on? She's not at all anxious. My son started above that in anxiety because it's March. Playoffs are coming. He's not worried about university. That wasn't on his radar. Hockey. He in his second year of junior A. I only get 3 years. I really wanted to, be in the playoffs. His anxiety so quickly was very high. And going back to our conversation, somebody like my son who has associated himself as a person and with all of his sort of stress release mechanisms are related to sport, are related to being with teammates, are related to a structure related to exercise and competition. All of that is taken away. So his coping skills were low very quickly. So then you kind of go through that anxiety, being upset, maybe a little bit interested, to kind of getting in the vibe, or almost kind of like, okay, we'll just get through this. And then it's like anxiety, anger. What do you mean this isn't going to happen? Because the less we feel in control, the more we felt like we were getting on top of this over the summer, the more it felt like a disappointment and that we really don't have control of anything when we saw those cases increase. When the truth is, it really was our behavior that leads to the escalation in cases. So we kind of do have a lot of control. It just feels like we don't.
Well, that's an excellent point. So because you hear lots of theories, you see everything online, and there's John Stewart had a quote once I read that I thought was the best. We're a society that believes everything you read online unless it has LOL at the end of it. So what is it about the behavior? This is now going to your scientific background. What is it about our behavior that everyone is questioning, but that really is responsible for the exchange of the virus, or that is putting us in the position of allowing the virus to continue to strengthen, to grow?
The challenge with this virus in particular is that you are actually most infectious in the 3 days before you have any symptoms at all. And once you have those symptoms, that's when your viral load is the highest. And so again, opportunity to spread. So it runs counter to everything that we think about with respect to disease. You know that when you become in contact, for example, with influenza, you get sick hard and fast. You know within a day or two that you're sick, you're down, you're out, aches, pains, chills, all of that, you're in bed. So you know there's something wrong. You're probably staying at home and away from other people so that you're not spreading it. So in a situation like this with so much asymptomatic spread, it's very hard to wrap our head around this concept. Even when we see the data day after day, most of us don't not believe that people are dying in the hospital or suffering from illness. But when you don't feel anything, it's hard to stay vigilant. It's hard to stay vigilant against a threat that you can't see. We're not made that way. So that's the ideal strategy for a virus, just to be under the radar and keep spreading. And then the more it spreads, the virus gets into our cells. It's using our cells to make millions and millions and millions of copies. And with that are opportunities for mutations. Sometimes those mutations don't matter at all. They really don't make a change. But sometimes, bingo, there's a mutation. And what we're seeing now with the variant out of the UK and South Africa is that one actually did matter. It happened to be a change that made it much more infectious and easy to spread. And it takes nothing at all for that anomaly or variant to become a dominant strain. You just have to give it the opportunity, give it a couple super spreader events with people who, again, don't feel sick or might feel mildly sick. They're together, and off you go to the races now with a new strain that's even more infectious.
Wow. So that's interesting, because a lot of people in Canada talked about, let's immediately stop flights from Britain, for example, when they first found that second strain. Is it more, do they morph quicker? Because I did hear, and I don't know if it's true or not, so maybe you do, that the virus did transfer to an animal, which then transferred back to a human. Does that make it a change? Is that something we're worried about? Can that happen with this virus?
So the most challenging viruses to eradicate, well, there's a few things you need for eradication. And in our history, the World Health Organization declared smallpox eradicated in 1980. So it's very hard to eradicate, which means completely get rid of a virus. The things you need to achieve that are a vaccine and a treatment. You have to have those. But what makes it more challenging is if that virus can thrive in an animal and in humans, because it can, if it's in an animal, and even if all of us are kind of social distancing, staying separate, and that virus is still in the animal, it can then be spread amongst that species, mutate, and then if there's the opportunity through, one of the lessons from SARS, which unfortunately we did not adhere to, was the dangers in animal husbandry, in food handling, and in wet markets. So when you have an opportunity for an animal that might be infected with that virus to infect another animal, it's not that somebody ate a bat, which might have been the originator of the virus. It's the other animals that people did consume were infected by that bat. So it's the animal infection that became a human infection. And then now you've got opportunity for variants and spread to occur amongst both species. And we already know it can transmit. So it's certainly much more challenging.
Right. Well, that's good. Good to know, and thank you for clearing that up. It actually makes much more sense to what, again, you read on the internet and such. So now let's bring us back to where we are today and what people are hearing, because I know there's a lot of frustration towards different levels of government, and I respect that, and I'm not going to. I don't like to throw stones at different levels of government because I believe they're doing the best they can. They're going to make mistakes, and we just all have to be patient as we go through this. I know it's difficult. I know it's hard. And really, it's very easy from the outside looking in to say, well, we could have done it this way or we could have done it that way. You don't have the constant pressure on top of you to do something that's going to work. So we have to think differently when considering where to assign blame, if you will. But what is it that do you think that as political leaders or being people in the community, in leadership roles in the community, what more could we be doing to really help residents in the city and really help get that message out there that we just staying vigilant is an important part of it, but that we understand. I don't know if we're really talking about the fact that we understand their frustrations. We're with them. Do you know where I'm going with that?
That's right. So when we look at pandemic planning and management, the first thing on the list is about leadership and about communication and about transparency and about building of trust. And you can see over time the impact in areas where there was not transparency or building of trust, or there was mixed messaging between leadership and scientific leaders, so political leadership and scientific leaders, which confused community members. And somebody's going to trust this person and somebody's going to trust the other person. And we need really a trust that goes together, and that is role modeled. So, we have to sort of reflect on, as in any leadership role, what the difference is between, for example, a transformational leader and a transactional leader. So we were learning as we go. People make mistakes, or they might call a mistake, but literally just didn't have all the information. A transformational leader will continue to communicate and say, this is what I thought, this is what I know now, or I understand now. So moving from what you thought day one and including those people to whom you are a leader, whether it's a hockey coach or a city councillor or the premier, that transparency and inclusion is really important, as opposed to being transactional and refusing to admit that what you thought on day one isn't what we now know. Because not only does that not help with getting the disease under control, it doesn't enhance trust when you are giving one message and others are giving another. And it certainly doesn't enhance trust if leadership is giving a message and then actioning in a different way than what their words are telling people to do. So I understand what you're saying. It's, you were asking about sort of ensuring that there's also empathy relayed from leadership to community members, in the sense of understanding that this is not, there are no solutions without risk, and risk can be, again, to our social well-being, our economic well-being, or our health. And leaders are constantly balancing that incoming information. All I'm looking at is health information. But imagine, well, you don't have to imagine, you are a leader. You've got people at all levels coming at you with different information about the economic impact, social impact, health impact, impact on EMS, etc. And you're trying constantly with a moving target to say, what's the right decision today, being fearful about, well, but what if I make a mistake and we go back to square one? But I also understand that citizens are suffering, and how do you determine what's the most, quote, important suffering? It's very hard. It's very complicated.
Yeah, very well said. And I do appreciate that. And I've long come to believe that, as long as we're open about mistakes that we've made, whether they're probably not mistakes, just errors in judgment that we're learning. We're just real people like anybody else. I think that is the best way forward, because people just want to know what's going on. As long as you're giving them the actual factual information, you're open and honest with them about it, and they're a part of that team moving forward, I think that then they can better understand that, right? Like, no, I hate to use the movie quotes, but knowledge is power and such, but it really is. It helps everybody better understand. And I think we do need to have more of that. And I do like talking to somebody like you. No disrespect to political leaders, because I'm in this world, but I don't like to think I'm in the world, but I am. I'd rather hear from somebody I know who has taken the time to study the profession, who has earned the respect in the field, so that I understand. That's how I learn. And I want to learn from somebody who has that credibility. And a leader, to me, has credibility when they say, I was going down this road and realized that was the wrong road. So we're going to turn now, and we're going to start going this way, and it's going to take this long, maybe. And, but this is how we're going to adjust along the road. As long as I know the path we're going down, I don't feel like we're driving down a blind road. And I think that's what residents really want right now. And eventually we will get there. But so let's just finally wrap up on a little bit of this and the vaccine that's coming out, because you hear lots of course, I'm getting lots of questions about the vaccine and why is it taking so long? Why, how are they picking this group over that group? Who's going to get it first? Who's going to get it last? Tell me, as from your scientific background as well, what leads to the decisions on who gets the vaccine first and why, if you can?
Certainly. So there's a couple of different things that lead into that. One is who is the health vulnerable population? Who is the exposure vulnerable population? So looking at those two factors, who's most at risk from a health perspective if they come in contact with that virus, but then who's actually most at risk of coming in contact with that virus because they might not have the worst health outcome, but then they can spread it. So you're weighing who's the health vulnerable, the exposure vulnerable, and with that, reflecting on what did you learn from the clinical trial of that vaccine, up with what population was the highest efficacy. So even if you have a group that's potentially health vulnerable, for example, if that clinical trial didn't show that it actually had good effectiveness in either stopping the symptomatic disease or progression to severe illness, or what we want the most is stopping the progression of the disease, of transmitting it, you would that's not the optimal use of the vaccine. So again, there's several things to weigh. What do you know about how effective that vaccine was? What did we mean by effectiveness? With what population? And then is that group, does that link most obviously? And an example in Manitoba was they kind of merged those two. And they said, we're going to merge exposure vulnerable and health vulnerable from what we know from our outcomes. And not only are we going to strategically plan to roll this out based on where you work in the healthcare system, we're going to focus on birth years to start with. So you had to be in a certain age group as well as in a position, because that was sort of an efficient way of starting out with the limited resources we had, of trying to combine those two, and then you move from there as you have resources, vaccine available.
That makes incredible sense, and that's the the conversations that we've had. I have very elderly in-laws in their 80s, and they're very spry, and this is impacting them a lot because they were always very active and they're always wanting to be out and see family. So they're stuck indoors and doing everything they can, but they're becoming incredibly vibrant online. They're with the Zoom and all that kind of stuff. So it's fun watching that. But I always wondered, like, I'd rather see people older get it first. But the way you have explained it, that makes perfect sense to me. And it's interesting how, again, it gets tossed all around about, wow, this is wrong and that is wrong and that is wrong. But the way you have explained it does make perfect sense. Do you think that everyone's talking about the timeline, and I hear the media talking about this a lot too, and I have one final point on the media I want to ask you about to close, but do you think the way that they're timing it, like saying we're going to try to do 10,000 a week, and as we get more, we'll do more, this is the right way to do it, right? I mean, there is, to say we're going to do everybody over a couple of days is just not possible.
Agreed. It has to be a strategic methodological approach, sorry, but it has to be achievable. So what is the optimum strategy? And in that strategic direction, what can we really achieve? Is it 2,000 a day? Is it 4,000? Is it 10,000? What is an achievable step toward achieving our goals? Because again, you don't want to make promises that fall flat. It just kind of goes through what we talked about at the beginning, that curve of emotions and frustration, and then gets into trust issues. So you want to be sure of what your supply chain is, where you're going to be able to bring people together, put them through quickly and safely, being vaccinated, and based on what vaccines we have, what can we do in the north right now, and what do we have to still kind of focus on in areas such as Winnipeg. So it might feel slow, but it has to be based on an achievable solution and resources that are available.
Yeah, well said. And my kind of final point is how this is being talked about by media and online, and how that might be impacting people. And, full disclosure, I was a senior executive and CEO of media companies, and I more on the corporate side. But it's really disappointing because I find that when we talk the most about COVID, we're talking about the negative. We're talking about the headline grabbers. So when we talk about the number of deaths, I don't feel it's being humanized at all. It's just these are the number of deaths today, and this is and then we move on to the next. So this is the number of cases. I'm wondering if we need to find a better way to start talking about it, where we're informing people, but we're also talking about why aren't we talking now about the number of people that have been vaccinated, and really because that's a positive, because now we're getting into that herd process, or to the herd vaccine process. I'm not sure the proper term.
Herd immunity.
Thank you for that. Yeah. So do you think, now I'm going now to your psychology degree. So this is great having science and psychology together. But would it be better for us to start including some of that positive as well, and focus on that, as opposed to just, why can't you give out more vaccines? When are you going to start? Like, this is the questions coming from the media, and I get it. You wanted that headline, but I mean, haven't we had enough negativity for a few years? Like, just in this year alone, I think we've had our fill of that. Let's start looking at the positive. And do you think that would help?
Well, there's sort of lots that we can kind of take apart there, but a quote, and I forget to whom it's attributed, is, one death is a tragedy, a million deaths is a statistic. At some point, that volume of negative information, we just numb. It's not humanized. It doesn't mean anything. And again, if it does, it feels overloaded. It's like, if I need to lose 7 pounds, that's achievable. If I need to lose 400 pounds, maybe I just don't even try. So, but even to your point about reporting on vaccines, even if we're at a lower rate than would be ideal, and then you start comparing yourself to other countries, and what are they doing? Well, they're other countries. They're not Canada. So just like, don't compare yourself and your weight goals or whatever they are to somebody else's, because even if you lose 1 pound, or you stop smoking 1 cigarette a day, or you drink 1 less Coke a day, it's about harm reduction. But with that, feeling pride, I set a goal and I'm moving toward it. So same with this vaccine distribution. We're not where Israel is, but we're also not 9 million people living in a highly densely populated society that had a different opportunity with the supply chain in a very just a very different circumstance with us than us. And I've been to Israel 3 times, absolutely love the country, but I can tell you it's dense. It's not Canada. So, let's learn from what the successes are in terms of logistics and strategies in things like vaccine rollout, safety, all of that. But let's not then just beat ourselves up because we're not doing what somebody else is doing. Let's focus on, we're not maybe where we want to be. Okay, let's understand why. Is it a supply chain issue? Is it a planning issue? Is it an isolated communities issues? We've identified our First Nations populations as priority populations. Many people live in northern isolated communities. It's harder to get there, but we will get there. So I think that that's really important. And I think always that when we think of the public health approach to communication, and I firmly believe that Dr. Rusin and Ms. Saragusa do this very, very well and consistently, which is, what is the problem? Tell me what the problem is, or the issue. Tell me what you're doing about it as the leadership or healthcare system. Now tell me what you need me to do to be part of the team. Don't stop at what's the problem. And don't jump to, I need you to do this. I want to understand as a community member how those 3 pieces work together. And I want to understand what you saw as a result of that. So I really liked when we first were getting information about, staged approaches over the summer, and all of the provinces were kind of putting together plans. Written within his plan, the Chief Medical Officer of Health of Saskatchewan said, with every stage, we will consistently focus on empowering and educating our community members. Always written right into the plan. And I believe that Dr. Rusin and Ms. Saragusa do role model that. But when I was asked to quickly review that, I never forgot those words from him, because he was bringing again that approach of people need to be educated and empowered, not frightened or feeling hopeless or helpless.
That is that's excellent. What a great statement. And I do recall hearing that and hearing another colleague talking about that. I know your time is stretched, so I'm just going to leave you with one question, and that what do you say to those people today that are at the end of the rope? They're kind of there, and they're just going to have people come over anyways, or they're just not going to follow this anymore. They just don't think it's working. It's not necessary. As quickly as you can, what do you say to them?
I understand how you feel. As a mom, sister, daughter, all of that, I get it. I have those days myself in terms of feeling like this is really, really hard. But here's something from the Center for Disease Control from a recent study. Household spread of this disease is common and it's quick, and it's frequently asymptomatic. So the more you bring people together, the more opportunity that disease will spread. It's not an anomaly or unlikely. It's common and it's quick. And the more you bring people together, the more you're actually sabotaging the businesses that are paying a huge price. By bringing the group to your basement instead of being in a restaurant or a hockey game or a gym, you are still spreading the disease. And in the meantime, those businesses are shut down. So when you're feeling down, the answer is not to sabotage, it's to be part of the solution, but to reach out. And also, we all need help right now, but we have to find help in different ways, and we have to find help virtually or go for a walk, those kinds of things. And I know it sounds like rose-colored glasses. It's not. It's just, I'm telling you, you're sabotaging yourself, you're sabotaging community, and you're sabotaging the businesses the more you're not complying with the public health mandates, which are based on sound science.
Cynthia Carr, thank you very much. Thank you for spending time with all the media in the city. Thank you for spending time with us here today. And you may not hear it a lot, but when I hear you on the radio and I've seen you in other media, you are a very calming voice. I appreciate what you have brought to our city and residents during this difficult time. So thank you very much. Cynthia Carr from EPI Research Incorporated. I hope I have that right. So I appreciate your time. And again, thank you so much.
Thank you. It was a privilege.